Renew Wisconsin has a simple mission: create a future powered by renewables through advocacy, education, and collaboration. By producing clean, reliable energy right here in our state, we can create jobs, keep energy affordable, and combat climate change. Everyone can and should benefit from clean energy, and with your support, Renew can make it happen. Donate at renewwisconsin.org today and help create a cleaner, healthier tomorrow. Madison Community Foundation helps donors support the community and the causes you care about most. With philanthropic expertise and personalized guidance, Madison Community Foundation makes it easy to achieve charitable giving goals. Whether you choose a specific field of interest, open a donor-advised fund, or create a legacy that will last for generations, Madison Community Foundation is here to help every step of the way. Make your gift today. Learn more at madisongives.org/giving. This is CityCast Madison. I'm Bianca Martin, and here's what Madison's talking about. Today, how can we stay healthy and health informed during our current period of widespread health misinformation? I'm sitting down now with a Madison radio legend, recently turned podcaster. Look at it, that's his laugh. If you know it, longtime host of WPR's Zorba Pastor on Your Health, and now the new podcast host of Stay Well with Dr. Zorba Pastor. Zorba, hello.
Good to be here. Thank you so much for inviting me. I really appreciate it.
Yes, you're such a delight, and you are a legend. So, no, you truly are. So it's an honor to have you on, and it couldn't be better times. It couldn't be a more important topic. You've got a new show, which is a continuation of your work in spreading health literacy and helping folks stay healthy and make health-forward choices. So congratulations, and how are you doing?
I'm doing well. First of all, the public radio show was great. 35 years. It had legs, as we say in the industry. How many shows last 35 years? Not a lot of shows. And the idea is to give good curated medical information in a digestible form that people will like, people will listen to, scientifically based. I'm a scientist. They come to me scientifically based. When I look at information, I don't go to politicians. I don't go to celebrities. I don't go to my gardener. I don't go to the mailbox. I want to do science. That's where I'm at. And that's been my whole goal all along. And 35 years ago, my regular job is a doctor. I've been a doctor for 45 years. And one day I was sitting in my office telling somebody to quit smoking, and I thought there might be a better way to do this, and that was my jump into media, and that is now my jump into podcasting.
Oh, I love it. How to be even more effective. Get a talking piece, right?
Right. Yeah, that's exactly it. And look at the way we're just talking right now. Just the idea that we can talk about things, and that's what's missing. We get screaming and yelling, you've got to do this, you shouldn't do that, you've got to do this, you shouldn't do that. And the only way to give people good medical information in Wisconsin or elsewhere is to sift and winnow and give information that you can use and you can talk about with your neighbors, and then you can make the best decision for yourself.
That's so important. Have some civility and something as critical as health, right?
Civility? How do you spell civility?
KG.
Civility, out of there, reaching across the aisle. Where did that come from?
We're touching on something that there's a moment happening. Like, how would you describe the state of access to reliable health information right now?
Two different ways. First of all, that's a really great question. We have access to more good health information now than we have ever had before. We have to put that on one side. Think about it. When I first started out with this, when I first started out on the radio, if you wanted information, you had to go to the library. When was the last time you walked into the library and went to an encyclopedia?
Not that often. Remember the Dewey Decimal System and having to actually look at physical cards.
That's right. The cards and everything. And then the book you would pull out would be old because it was printed, it was old information. So you did not have access to good information. But enter the web. We now have great medical information that we can get. In fact, we have so much information that you could logically say we have too much information because we don't know where to turn. Then we have the other side. We have misinformation. We have fake news misinformation, which is up there. The ain't it awful, the don't do this is wrong, that's not the way, all of that other stuff. And so we've got to sift and winnow. We have to figure out where we're going to go from one spot to the other. And I think there actually, and I never thought about that until now, I think there are some simple rules. I've never thought about this before I've been on the podcast, and now I'm going to give you some simple rules. Are you ready?
Okay, yeah, let's go. I mean, I was going to ask, like, where do you recommend folks go? And it just came to you, so hit it.
Well, it's on a broader aspect. There are the yeses and the nos in life, okay? There are the do's and the don't do's in life, okay? So if you're just looking broadly, if someone says, don't do this, that may be misinformation. Just immediately put your hackles up. If they say, don't take this, don't do that, the don't do's, chances are very likely, maybe 50, maybe 75%, even more, that is misinformation. I'm not saying globally, but the don't do's are going to be misinformation. Let's look at the yeses. In the yeses category, we have yeses that are going to make money off of you. Yes, take this supplement, you will be 10 years younger. Yes, go to this, give me $50 a week and I'll make you better. So the yeses that get money from you, and then the yeses that are engaged in institutions that you believe in. Your doctor, your hospital, your university, something such as that, institutions. And those are the broad ways to begin to look at it. The people who say yes, never thought about this now, and the people who say no. So if you look at Washington right now, you've got a lot of no's. Why? Because you've got RFK, who is clearly, he clearly is a bunny. I'm going to call him a bunny.
You're talking about Robert F. Kennedy Jr., United States Secretary of Health and Human Services.
Yeah. I could call him an alligator or bad thing, but I think a bunny. Bunnies they're pretty dumb. They jump around, they look for food, they get picked up by foxes and eagles, but he's a bunny. But he's a bunny with a lot of control. So that bunny doesn't believe in immunizations. Immunizations have done more to save human beings than any other thing besides hygiene in the world. We don't have smallpox anymore. I used to see children who had meningitis. We don't see that anymore. Measles, mumps, rubella, RSV, you name it, it's good. But here it is, the silly bunny is jumping around saying, no. So he must be wrong. He's in the no realm. So I think part with medical literacy is think about the people who say yes, think about the people who say no. And once again, think about people who want to make money off of what you're saying.
And I think I should probably say that, Robert F. Kennedy Jr., isn't he kind of towing the line where he's not outright saying that immunizations are bad, but then the decisions that the Health and Human Services are doing are heading in that direction and really putting a lot of scrutiny and trying to push us away from immunizations? Or maybe I'm wrong.
No. You are right. So first of all, he's not saying that directly because bunnies don't really talk. They don't talk. Have you ever talked to a bunny? So he doesn't talk. He just pushes people to do things. And then he pushes on the outside, like, let's get rid of some of the insides, what we have for immunizations, so you guys can't produce them. Now, some of what he says is actually good. Like, we should get rid of ultra-processed foods. That's the problem with the RFK bunny.
I think this is a larger part of the conversation that what do you believe? I do understand this to be true, but I don't understand this to be true. And at the top of my concerns is science first.
And there is some science involved in some of the things he says. Like there are issues that are fluoride that he's somewhat correct with the science. Issue with ultra processing that he's somewhat correct with science. Definitely issues with overcharging us, the American consumer, that is absolutely the case. So you've got the mix of some things that are really there and then other things that are not scientifically based but are voodoo.
Well, so let's talk about that because, We'll just say health literacy is tantamount. We cannot be out here having people drinking bleach. We cannot be out here, it's not good for us. We want healthy citizens. We want to live great lives. We want that for everyone. And depending on which corner of the internet you find yourself on these days, like anyone without maybe the right training or education could theoretically come to a conclusion they should be prioritizing beef tallow above all else. They should be drinking raw milk and possibly avoiding vaccines. And it's just it's way too easy. We were talking about obviously RFK Jr., but there are so many content creators who are out on the internet speaking authoritatively, not necessarily with expertise. And how do you, Zorba, combat that tide and also personally protect yourself from getting duped?
Well, we all get duped.
Ain't that the truth?
Come on. We all get duped. You hopefully get duped minimally, and you can get back what you were duped for. Like you said, you've got the 5 or 10%. They're down the rabbit hole. They're never going to come out of that rabbit hole. I can't find those people. They're really down. They're at the extreme. What about, for instance, the people that are immunization curious? Let's look at the young adults that have a young child and they're immunization curious. They get the information that comes over here that say immunizations are bad, and they get the information that comes over here that say immunizations are good. They don't see the diseases because we've immunized. I had measles, I had rubella, I had chickenpox. We don't see those anymore because they don't exist as much. They may come back.
Isn't that wild? Like chickenpox?
Well, they don't come back. I mean, they're terrible. And measles, when I had measles, the thought was you were going to go blind. So I was in Chicago in the middle of the summer in a hot house. We had no air conditioning for 10 days in my room, no television. I'd never read. It was terrible. Eating boiled beef. My mother thought boiled beef is what you fed. It turned out the light didn't make you blind. It was actually meningitis that made children blind from measles, and it had nothing to do with light. But, that was the tale that came out, kind of like fake news, old wives' tales. That's what came out. But we don't see these things. So when you don't see them, you don't realize that they're potentially bad. So I think what's going to happen in this country is we're going to have some outbreaks, and we'll have 10, 20, 30 kids die. And that'll begin to turn it. I think we're going to have deaths and outbreaks to start to get people to stand up a little bit more and say what happened. We've had outbreaks in Texas.
And we saw a bit of a measles outbreak.
Yeah. But not enough deaths.
Not that big.
As weird as it is. We've had outbreaks, but we haven't had deaths. And once we start having more deaths, then that'll start to come in front of the news, and people will say, wait a minute. The other thing is, data that came out pretty recently, 80% of all the mothers in the country, no matter which tribe they're on, the red tribe or the blue tribe, say they think all the children should be immunized before they go to school. That's interesting because they want their kids immunized. It turns out to be a large number. You think it's a small number, it's not. And so it's a matter of getting that information out, reinforcing it on media and podcasts so that they can then fight against the misinformation that'll come from the noisy 10%.
Since 1991, Renew Wisconsin has worked to build a future powered by renewable energy. We can produce so much of our energy right here in Wisconsin with clean options like solar and wind. This is a path to build a resilient economy for our state, an economy that keeps energy bills low, protects families from harmful pollutants, and takes climate change head on. Despite the forces working against these efforts, Renew believes that a future where everyone benefits from renewable energy is within reach. With your support, the hardworking people behind Renew's mission can continue to advocate for legislation and policies that support common sense energy solutions at the state and local levels. Together, you can end the reliance on costly imported fossil fuels. Donate today at renewwisconsin.org, and you'll join the clean energy revolution for a cleaner, healthier tomorrow. Four Seasons Theater presents The Hello Girls, a new American musical. It's an uplifting new musical inspired by history that chronicles the story of America's first women soldiers. These intrepid heroines served as bilingual telephone operators on the front lines. They helped turn the tide of World War I and pave the way for future generations of women in the armed forces. Ready to feel empowered? The Hello Girls runs December 11th through the 21st. That's Thursdays and Fridays at 7:30 p.m., Saturdays and Sundays at 2 p.m. at the Playhouse at Overture Center. Plus, there are pre-show lectures, Thursdays at 6:30 p.m. and Sundays at 1 p.m. in the Playhouse lobby. This is a remount production from spring of 2024, y'all, that played to sold-out audiences, so you know it's good. Learn more at fourseasonstheater.com. Tickets are available starting at $25 through the Overture Center box office in person, by phone at 608-258-4141, and at overture.org. Madison Community Foundation works side by side with donors who want to make a positive difference in the place you call home. For more than 80 years, Madison Community Foundation has supported local nonprofits, schools, parks, trails, and cultural spaces, helping ensure Dane County remains vibrant, welcoming, and full of opportunity. With personalized philanthropic guidance, Madison Community Foundation helps donors support the causes that matter most to you. You can focus on issues and causes you care deeply about, establish a donor-advised fund for flexible giving, or create a legacy that continues for generations. Every gift, big or small, strengthens our shared future, and Madison Community Foundation is here to help all donors achieve their charitable goals. Make your gift today. Learn more at madisongives.org/giving. There's so much reverberation from the loud minority in these times. It's absolutely wild. And I know we've been talking about it, but this national climate around health and how we protect our health is just so under contention as a nation. You know, and we're talking about the current administration making drastic changes to our medical research institutions' fundings, shifting priorities for the Centers for Disease Control and Prevention and the Food and Drug Administration. And these shifts around, kids' health through the sort of Make America Healthy Again or MAHA movement. Right. There's so much uncertainty. You know, the latest story that's got me concerned is the deregulation of the Environmental Protection Agency, the EPA. Specifically, I saw that the EPA approved pesticides with PFAS, the forever chemicals. The new story, how do we navigate this moment with so much change in our institutions?
Well, we navigate it through podcasts like yours. That's how we do it. We navigate through podcasts like mine, Staying Well with Dr. Zorba Pastor, because we've got to navigate it with information. I mean, ultimately, you've got to navigate it with information. Then you have to navigate it with a kind of what I call a call to action. But I think the call to action doesn't have to be big. I mean, you should do big things, marches and big things. I think most of the good stuff comes from low-hanging fruit. Your neighbor, your friend, your cousin, your relative. That's where I think you make change. In a very general way, talking about it. Have you thought about this? Not nagging. Nobody wants nagging. Nobody wants yelling. So I think it's small changes. And I think those small little changes will make a difference because that's the way society changes.
Are there any false theories that are floating around this moment that you're particularly concerned about that you want to throw some light on?
So first of all, to stabilize the productions of vaccines are not easy. I mean, there's a lot of complex things. You can just imagine. It's a whole bunch of complex things.
How we watched that play out over the COVID-19 pandemic and the development of the vaccine. Yeah,
really, really complex. So I want to talk a little bit about aluminum. Aluminum is a metal which is safe. It's in our environment. It's in a whole bunch of things. It's not just in your aluminum cookware. For instance, if you take, it used to be Malox, which is a medication you take for heartburn. It contains aluminum hydroxide. So it's all around. Aluminum is used as a stabilizer in vaccines. It used to be mercury, but about maybe 30 years ago, 25, 30 years ago, we got that out because we were trying to get all the mercury we could out of all of our systems. We now use aluminum as a stabilizer. So the bunny, RFK, the bunny, says, I want to have them out of vaccines. Well, the reality is, it may not be possible to get them out of vaccines because that may not make the vaccine stable, in which case you can't produce the vaccines. So the real question is, does a trace bit of aluminum in the vaccine mean anything? Well, on the surface, you go, I don't want any aluminum in my vaccine, right? I don't want to have this in here. On the other hand, I think I'll fry an egg in my pan, and my pan happens to be aluminum. And I think I'll touch aluminum on the wall, and I'll do this with aluminum. There's aluminum in my car, and it's all over. It's ubiquitous. So we have to work on that because it's, once again, you put it up as a scary tactic, which is really what the devil likes to do. The devil likes to put out scary tactics so that you go down the dark side. You think I was religious talking about the devil. I have to tell you, I don't really believe in the devil.
Sometimes, Zorba, your last name sounds like pastor. Sometimes we are out here and then we start sounding like preachers, but it's because...
I'm a pastor.
You are, yeah. But, this might be straightforward and evident, and maybe we've already laid it out clearly, but why is it so important that people are health literate?
Well, because I'll give you a perfect example of a mistake that started early on in my practice. A young woman, urinary tract infection, sent the urine off to see if she's on the right antibiotic. She had a sulfa pill, 1 pill twice a day. She was probably 21, 22, had a kid, 1 child. I came back 2 weeks later, 10 days, 2 weeks later, got her urine checked, and it wasn't cleared. So I gave her a different antibiotic, and it was probably amoxicillin, 1 pill, 3 times a day. Brought the urine back, wasn't cured. Happened a 3rd time, different antibiotic, all checked out, wasn't cured. Okay, the 4th time she actually came in the office, and I said, I just have to know what's going on. We've done it with 3 different things. I've taught you about hygiene and stuff. Let me talk about the day. So she said, I get up in the morning, and before I breakfast, I take my first pill. I said, okay, and what do you do after that? She said, well, then I take my 2nd pill. I don't want to forget that. So she was taking all her pills at one time.
Like one after the other.
Right. She didn't want to forget.
Out.
She was taking 1 pill twice a day. Right? It's a good example of health literacy. Right?
Yeah.
It was 1 pill twice a day, and she was worried about forgetting it. And she was doing that with all of her medications. She wasn't a dumb person. I didn't think she was dumb.
No.
I thought she was a typical 21, 22-year-old. But it's a good example of health literacy and how basic health literacy plays out. And we all have to read about health. We have to read about health. We have to study health. We have to go to things like my website, Stay Well with Dr. Zorba Pastor. Because the more you actually learn about health, the better you become, so you can sift and winnow and figure out what's right and wrong when stuff like this comes out. We're in this anti-science surge. I don't think it's bad. I think there's bad things coming out of Washington, but if it pushes people to learn more about how to think about their health, that's actually good.
So it's actually a moment for more critical thinking, which is good. Yeah.
Yeah. Don't you think critical thinking is good?
I think critical thinking is good, and I think the challenges we all face seem to be, a lot of them, financial. And I just want to bring up the point that your long-running show on WPR on your health, unfortunately, got caught up in the financial woes over at WPR.
Absolutely. Right. That's right. Right.
And, they cut a number of shows, and it's like we're talking about the importance of your work and health literacy, and former public radio host here and WPR listener. It was really sad to hear. And so, the good news for you and your many fans is you've got this new podcast, and, I want to think about this moment in time, how you're feeling about, that change and transition and your legacy and what you're hoping for the future with this work. And yeah, I know it's a big question. But.
It is. Well, I love the show. And how could I say I'm not disappointed? I'm definitely disappointed when the show, when they told me I was at Costco doing some shopping and I got a text, by the way, could you come in tomorrow at 10 o'clock in the morning? Now, you never get a text like that for something good. Can you come in?
When you're not expecting it.
I knew there were some troubles at the station. I knew exactly, this is what it was. And it was very disappointing. I mean, we loved the show. At one point, we had 150,000 listeners. At one point, we're on in New York and San Francisco. We're on in Texas. We're on in Miami. We're on in Houston, a whole bunch of places. And public radio comes and goes like other media. I'm on TV, on News 3. You know, a lot of people are not watching local news now, right? Because of cord cutting. They never, forever, that was the information. So, yes, it was disappointing. But with that then comes, how do I continue what I think is my raison d'etre, which is to give good information. So the answer is to work with Carl. He's great. He was my producer. He's my co-host. Figure out a podcast, which I think is funny. It's bouncy. I have a number of friends who said they like it better than the radio show. I said, really? Well, that doesn't say much. But actually, it's unshackled.
It's a different format.
It's a different format. It's unshackled. No, I like the comment. I think it was good. It was like, hey, you painted the room. The room looks better. It doesn't mean the room looked bad before. It just looks better now. And it gives...
I like your new girlfriend.
Really? I actually have a girlfriend. My wife died 2 years ago. I actually have a new girlfriend. So you said I like your new girlfriend. And look, you touched her heart.
I'm a little softy. But we love, and we also love Carl Christensen, your producer you mentioned, who, by the way, for y'all out here listening and you listen to the credits that I do every week, Carl Christensen did our music. So if you love our music here on the show, man, it's Carl. He's a winner. And also, if you go back, you can still listen to your WPR show. Like, the archives are still out there.
The archives are there. People listen, and people are coming to the podcast. You know, we're growing audience. We're at the very beginning. It's word of mouth. A lot of older people don't go to podcasts. I told them, all you do is stop any teenager on the street and say, pardon me, can you go to this podcast? And they'll do it in less than 30 seconds. There won't be any problem at all. And then people go, wow, that was easy.
Well, I'm so stoked about your new podcast, Stay Well. It is really fun, and it's got lots of nuggets of useful information, like so many topics. I'm like, oh, I wanted to know more about that. I'm interested in this. Like, can you just share a little bit about what you're hoping to bring on the Stay Well podcast?
Yes. So it's Stay Well with Dr. Zorba Pastor. We start out, we give a menu at the very beginning of the show. The 5 things we're going to do. 5 things, 22 minutes, you're out of there. That's one podcast. We have 2 different kinds. So we will do 5 topics. One will be a caller. One will be maybe a recorded call. And then I will go over something really topical in the news, like there's a nasal spray that is over the counter. It's an antihistamine nasal spray that will reduce your risk of getting COVID by 65%. New data, incredible data. Nasal spray, very, very important, called Astropro. Great spray, great particular study. And then there'll be a variety, I saw your eyes go up with it. And then there'll be a variety of other things. Behind the curtain, crack rate, recipe of the week, mom jokes, dad jokes, other things to basically move the information and make it bouncy.
You're bouncy, Zorba. You're bouncy. I'm kind of a bouncy person too. I really like you. Yeah, can you tell?
Yeah, you're bouncy. Hey, you are bouncy too. You're bouncy.
Bouncy.
You know, and then
I'll bounce it back to you.
It's bouncy. So then we do a rapid update from my house. So when I get something out of Washington that is come on, I don't believe in that. I'll do a 3 to 4 minute piece on that. So in other words, something comes out that says Tylenol causes autism. I have 2 words for that, and it's not happy birthday. It's my mother-in-law would say. So I will do...
That's a good phrase.
I will do 4 or 5 minutes about how Tylenol does not cause autism. That goes up, that pops out, and then pops in the mailbox. So the idea is it'll be a rapid update, maybe once a week, and then there'll be a longer podcast, and we're done.
It's so good. It's so good, and you're giving it that digestible piece, and it's fun and light, but it's serious. Like it's news you can use. Thanks. It's entertaining, and it's from a doctor. It's from someone
Yeah,
who
I'm a doctor.
understands science. Like it's reputable. So
I'm a real doctor. I'm not a virtual doctor.
yeah. Right, exactly. Well, there's so much to love. And, I just have one more question for you before we let you go. We're in this season of illnesses. Of course, they go around all year, but being
Yes.
indoors and all, they're spreading. Do you have any parting words for us for how to stay healthy this winter? Any good reminders or under the radar advice?
Okay. So I have a number of good things. First of all, hand sanitizer. Use it. Use it. You're going out, use it all the time. Why? Because you're touching people's hands, touching the door, and so on. If you don't want to get sick and you feel like you might get sick, you mask up in certain places. Where do you mask up? Going into Quick Trip? Because you're around people all the time. You're in very close, intimate contact with people. Think about it. You're going right by them when you're getting the donut, like I'm getting the donut, and you're practically this close to the other person. They breathe out, you breathe in. You're really in very close contact with them. Quick Trip, grocery store by the veggies section. Why? Everyone's leaning in, you're leaning in. These are just things, if you want to keep healthy, these are the times to do it. If you have somebody who is ill in your house or has been ill, I want you to go and get Stelazine. Stelazine, I'm going to look it up, is Azipro. I'll spell it for you. A-Z-E, Lastine. A-Z-E-L-A-S-T-I-N-E. There's a recent study that showed that this nasal spray reduced the chances of your getting COVID or another infection, probably like COVID, it would keep it by 60%. Let me tell you the study, really simple study. I believe there were 200 people. One got the nasal spray 3 times a day, over the counter, it's an antihistamine. One got a placebo 3 times a day. They didn't do anything. They watched them for a period of time for 6 months, roughly 6 months. They did COVID tests twice a week. If the first COVID test was positive, they did the PCR test. 6.9% of the people during that time period got COVID, okay? So in the placebo group. 2.9% got COVID in the Estelazine group. It was a reduction of 65%. And those who got COVID, their COVID was it didn't put them out as much. Their symptoms took longer to develop, and it took a short amount of time to get rid of the symptoms. And now there's more data that comes out that it may prevent other respiratory viruses that are out there. So if you're around somebody who had a viral infection, go to the pharmacy. It costs $7 and use this spray and put it in 3 times a day. Once in the morning, once at night when you go to sleep, and sometime in the middle.
What's working about it?
We're not exactly sure. It's an antihistamine, and it appears to somehow stop the virus from clinging to your nose. Had we known this during the beginning of the COVID epidemic, we would all be taking this because we'd have dropped the risk completely. So I'm going to leave you with that. That's good medical information. That's what we talk about on the podcast. That's what we have to get out. And remember, the yeses might be good and the no's should raise your hackle, as the no's mean it's probably fake news.
All right. Dr. Zorba Pastor, thank you so much for coming on CityCast Madison.
Thank you.
It's been an absolute delight. And
let's do it again sometime.
Yeah, honestly, it's cooking. You got to come back. That's Dr. Zorba Pastor, physician and host of the new podcast, Stay Well with Dr. Zorba Pastor. That podcast is linked in our show notes. And hey, he also does a weekly column with Wisconsin State Journal. That's all for today here on CityCast Madison. I'm your host, Bianca Martin. Don't forget, you can support the show and get great perks by becoming a CityCast Madison neighbor at membership.citycast.fm. And if you enjoyed today's show, why not share this episode with someone who cares about their health? And you know what? We're going to be back here tomorrow morning with more stories from around the city. Until then, take good care, stay well, and thanks for listening.
Hold on one second. spray, and I'll tell you why. So oh God, instead I've got men's cologne.